Welcome back and thanks for coming. We're going to be reviewing what's known as the EMR, or the Enterprise Medical Record. The Enterprise Medical Record, or EMR, are the buttons from the Select Visits down to the Refresh EMR or Notes tab. The Select Visits tab will allow you to view information from previous visits. If you have a more than a current visit selected, it will change the view of the information that displays within the EMR. In addition, through the EMR, you have the ability, by selecting the View PCI button, to link to information on the patient that was entered prior to September 1st, 2011. This link will remain until information can be scanned and added to the EMR through the Archive tab, available on each of the EMR tabs. The Summary tab is a section that contains an overview of the patient's visit. It is separated into various tabs. Within the Clinical tab exist the problems entered by medical staff. All other disciplines have view-only access. You can access the allergies. The active medications is a list of medications the patient is taking during their current visit. The home medications is a list of home medicines. The patient's pharmacy information can be viewed or edited from here. The medical summary will display documents from other facilities that have been scanned into the EMR. The health maintenance will display the patient's information from visit to visit. The substance use will pull from nursing admission documentation, and the procedure and diagnosis codes can be viewed from here. On the top of the Summary tab, there is also a Legal or Indicators tab. The Legal or Indicators tab will display if the patient has any post-form or advanced directives that have been scanned in by medical records. The Demographics tab will obtain information collected by registration. Growth charts are sometimes available for pediatric and infant patients, and the Referrals tab will show referrals associated to this particular visit. The Review Visit tab contains information in regards to the patient's admitting information. The Archive tab will show more information from the old medical record that we used to use prior to September 1st. The Visits tab will show current admission visit details. The Prior and Next will allow you to toggle between multiple visits to view the admission information. The More Detailed tab provides a view-only screen of admitting information for the patient. By clicking on the header tabs, you can sort and view various information. The Abstract button is where you will find patient abstract reports, which include diagnosis codes from previous visits. The Notices button is not something we are utilizing at this time. The New Results tab will be available if you have any new reports or labs on the patient. It is divided into 3 categories. New to you will display only labs that are new to you. Last 24-hour will display 24-hour review of labs. The last 48-hour will display a 48-hour review of labs. The Clinical Panels button is a tab. Each panel will contain clinical information specific to the clinical panel name, such as ED Visit Summary or Cardex. You do have the ability to manage your favorites and add portions of the clinical panel tabs to your favorites by selecting the ones you'd want to choose and select Save. Once you select a specific panel, you'll note that the footer buttons at the bottom of the screen will change. The Panels button will return you to your list of panels. The Visits button will allow you to select a previous visit if the patient had been admitted before. The different time frames available to view will allow you to customize the view of the clinical panel you see. You also have the ability to graph vitals from within the clinical panel. All panels, when open, will have the option to display active or ambulatory medications. Active medications are a list of current medications that the patient has been prescribed during their hospital stay. This includes scheduled and PRN medications, but will not include one-time stat or discontinued medications. Ambulatory medications will include a list of prescriptions and also include a list of the patient's home medications. The Vital Signs tab will allow you to access all vital signs that have been completed during a patient's visit. Using the scroll bars on the top from left to right will allow you to view a different range. And in addition, by clicking directly on the vital, it will provide the documenting provider and a range of when the vital was completed. By clicking directly on the name, temperature, or pulse, you can view the historical information that has been recorded for this example of temperature. In addition, if you noted, you also have the ability to graph that vital by choosing Graph on the side so that you can trend your data and then change your time frame based on what you would like to see. The I&O tab will display the patient's intake and output. The options for these tabs are the same as within the vitals. You would have the ability to click directly on the amount or click directly on the name to get the all available for that particular name. In addition, you would have the ability to sort by a different time frame. The Medications tab provides information on the patient's medications. The medication list displays the patient's current, active, and discontinued medications. Clicking on the medication name will display more information about that particular medication. If you note below the footer tabs, you have the ability to sort the medication list by choosing a specific drug class and then sorting the list as you need. The Archive button will display data relevant to the screen from the system prior to September 1st. The List button will allow you to change for a list format versus a more detailed format. The Lifetime button will display any active and discontinued medications that have been ordered on the patient. The Current button allows you to view only current medication on the patient. You can view medications based on active medications or discontinued medications, or view both together. The MAR button is a view-only version of the active MAR, and the Medication Snapshot is functionality that will be in use with CPOE. It will allow you to view home medications, admission medications, and discharge medication information. Clicking on the medication anywhere in the row will display more detailed information again about the specific medication. The Laboratory tab can be located, any laboratory data can be located from this tab. The header buttons vary depending on the results on the patient. They could include hematology, coagulation, chemistry, urines, and toxicology. The right and scroll buttons can be used to scroll through data. By clicking on a result name, you would have the ability to open all of the results for that patient. In addition, have the ability to graph if you need. To view a lab report, merely click on the date and time, and you would be able to view the entire lab report. Or by selecting the lab report at the bottom, you would be able to view a printable version of the lab report. The Lifetime Last Results button will allow you to view the latest results of all lab tests performed. The Flow Sheet button is the default format, and the graph will allow you to graph any selected test. To graph a particular test, merely right-click on the test and then select the graph button. To remove items from the graph, simply keep them checked and select the Remove. This will allow you to remove items from the graph. The Microbiology tab will display any microbiology results. You will display when items are collected. By selecting the Report tab, you would be able to review the micro report attached to this particular test. By selecting the grid, you would be able to view the information directly within the computer, or by selecting the MIC to actually review the counts. The Lifetime button again below will display any lifetime results that have been completed on the patient. The Blood Bank tab will display information obtained through lab or the transfusion administration record. The product summary displays an overall summary. The blood bank test will display a list of tests for the patient, and then the transfusions will display all blood products that have been transfused. The Reports tab will show blood bank reports for selected visits. The Reports tab will allow you to view reports from this tab. The header buttons will sort based on the different categories of reports. The clipboard icon, by clicking on this, it will allow you to view the report. A camera icon will appear to allow you to view the image, and a bubble icon will appear to allow you to view a comment. The footer buttons below are used to access archived information, lifetime last results, or lists of reports is the default. The Patient Care tab contains information documented on patient care. The header tabs allow you to sort the screen differently to find the information you're trying to obtain. The default setting is to assessment and date. You have the ability to subsort each of the top suggested items by the second line items, by date, name, recorded by, or provider type. To view an assessment, simply check the assessment wanting to view and select View History. This will allow you to view the assessment in question. The Intervention tab will allow you to view interventions that have been completed on the patient. The Outcomes tab will allow you to view any outcomes that have been documented from the work list or plan of care. The plan of care will allow you to view the entire plan of care, problems, outcomes, and interventions. The History tab will allow you to view the patient's past medical history. The Surgery Assessment tab will provide any surgical assessments that have been completed on a patient. The Scanned form will include a list of scanned patient care forms from selected visits. The footer buttons below the Archived will show old medical records prior to September 1st. The Earlier and Later will display a list of assessments if there are more than one page. The View Snapshot or View History will allow you to view the detail of the assessment. The Notes button will allow you to view patient notes from all different disciplines. The All Responses tab will include notes from all disciplines, and note you can also sort by a specific discipline as needed. Place a check mark next to the selected documentation you would like to view, and note that makes the footer buttons available to view selected or to view selected dates. If you would like to amend a note, merely open the note in question, select the Amend button, and then you would be able to type in your amend or additional comment from here, and then save the note. The final button within the EMR is the Refresh EMR button. It will allow you to manually refresh the EMR. The EMR will not automatically refresh if you have been in the patient chart for a long period of time. Thank you for joining us. We've reviewed the EMR during this section and look forward to seeing you again.